Hey everyone, it's Dr. Joyce. Chances are if you've had a dental filling in the last few years, or you're about to get your first one in a long while, your dentist will use a variety called composite fillings. Composite fillings are the new standard when it comes to repairing tooth decay. Most dentists no longer use amalgam or silver materials because they are more invasive to teeth and contain alloys that pose a concern for some individuals. With composite fillings, we can use tooth-colored materials that blend right in with your tooth. Composite is like a mixture of glass and resin particles that are capable of bonding tightly with your tooth surface, so they take up a lot less space than silver fillings and don't require cutting out healthy tooth structure. Instead, the composite is shaped to each tooth and cured with a special light. It chemically bonds to your tooth as opposed to being wedged into place like a silver filling. Some composite fillings even contain fluoride that slowly leach into the enamel next to it, protecting at-risk individuals against recurring cavities, which can happen. A recurring cavity is when a former filling gets another cavity within it. Composite comes in a dozen different shades, so your dentist can match your teeth to a shade and know which color will blend in with your smile. Another great perk is that white fillings can be placed on smooth areas, not just between teeth or on the chewing surfaces. This option makes it easier to repair your front teeth without causing any aesthetic concerns. If there's a cavity, your dentist just cleans it out and then covers over that area with the composite resin. In fact, composite is the same material your dentist uses if you're having cosmetic bonding done. Now let's talk about the treatment and what you can expect. Getting a composite filling is similar to traditional filling appointments. The main difference is that less tooth structure is altered and the overall procedure is a lot less invasive. Since larger, older amalgam fillings can predispose the tooth to breaking down around it, people usually have to get a crown after the large filling is updated years down the road. With composite fillings, the restoration is a lot smaller, so over time, when they need to be updated, you can usually just get another small filling. Let's talk about the procedure. Once your dentist numbs your tooth and cleans out the cavity or older filling, composite is matched with a shade guide and then shaped into the tooth, sort of like modeling clay. Your dentist will use a little tool to form the composite into the shape of the tooth in that space. When the final shape of the filling is just right, a bright light shines on the composite to cure it. A couple of minutes later, the composite is permanently hardened into place. We can place these white fillings on both adult and baby teeth. The only exception to that rule is if you have a child who is really wiggly and the dentist can't get the tooth totally dry. They may still need a silver filling, but that's totally okay. It's always great to have options. As with any dental filling, you need to take really good care of your tooth afterward. Getting a filling gets rid of the cavity, but it doesn't make you immune to getting more cavities. Whatever caused your tooth decay in the first place will continue to be an issue if you don't make a few lifestyle changes. Make a point to floss around your tooth at least once every day. Flossing won't pull the filling out. Instead, it will help keep the margins clean so that new cavities don't form around the edges. Like always, be sure you're brushing twice a day for 2 minutes using a fluoride toothpaste. And always see your dentist at least twice a year for regular checkups and digital x-rays. Your dentist will monitor the health of your tooth and other teeth to intercept issues while they're small, preventing the need for major dental treatment later on. On average, a typical composite filling can last anywhere from 5 to 15 years or more. This depends on a lot of variables, such as how well you care for your teeth and what your diet is like. If you're drinking a lot of sugary or artificially sweetened drinks, it can make you get a new cavity around your filling in no time, not to mention your other teeth. On a related note, white fillings, just like crowns or other tooth-colored restorations, hold their color over time. If you plan on whitening your teeth at a later date, you'll also have to get your filling changed out. Otherwise, you'll have an area of your tooth that is not the same color. This applies more so on the front teeth. So if you have a large composite filling on one of your front teeth and you decide to whiten your teeth, your natural tooth may whiten, but the composite may not. Be sure to talk to your dentist before your filling appointment if you plan on whitening your teeth. That way, they can always arrange to put something temporary in that space and match your white filling to the brighter shade of your enamel after you bleach your smile. Composite fillings are a great option because of their minimally invasive nature and how they match your teeth, and also their versatility. Ask your dentist today if a composite filling is right for you. And if you like this video, hit the thumbs up and check out this video next.